That's what you're saying.
Says there's 89 people checked in.
Yeah, I think we're coming up right now.
But I don't know how to log in.
I should be live now.
Yeah, you are. All right, well, good evening, ladies and gentlemen, and welcome to this Monday, November the 2nd, 2020 public meeting of the Board of Garrett County Commissioners. I want to welcome everybody watching at home. I'd like to call this meeting to order. Mr. Knoll, do you have any additions, deletions to the public meeting agenda?
No, sir, I do not.
Hearing none, do we have a motion to approve the meeting agenda?
Motion to approve.
And I'll second that. So the agenda is approved by mutual consent. Commissioner Heimball could not be with us this evening. He's got some family issues to deal with. So we send our best to him. Everybody got a copy of the minutes in advance of the meeting. Any additions, corrections, or questions about the minutes? Hearing none, do we have a motion to approve the minutes?
Make a motion to approve the minutes.
And I'll second that. So the minutes are approved by mutual consent. We do have with us to start this meeting today, Garrett County Health Officer Bob Stevens from the Health Department. And Bob's going to give us an update on what's going on with COVID in the county. And Bob, I'll turn it over to you.
Thank you, Commissioner Edwards. I thank you for taking time for this. And I also want to thank all the people who are tuning in and watching this on Facebook, whether that's live or whether that'll be in later today or whatever. I think it's really important because the message we get out is, on behalf of all the county, because we're all in this together. The first thing I want to say before anything else is that we have been up until a few weeks ago, a real victim of our own success, because we had been doing very well relative to the state, the region, the nation. We had been doing very well. And in the last couple of weeks, that's changed. What I'd like to do is to share my screen, and this might take a second for everyone, but I want to share my screen and show you a couple things on here. And so the data here is really going to show you what is so important. So the first thing we have is the positivity rate in Garrett County and within the state of Maryland. And of course, the idea was to keep the positivity rate below 5%. And we have done that for quite a while until we got to right about here. And that is, October 19th. So that's, remember that date. Another thing to look at, and this is information that is off the Maryland Department of Health website. You can check every county in the state, but this also shows you Garrett County with our case rate per 100,000. And if you look all the way to the far end, you can see that at one time early on, our case rate was higher than anybody else, because if you remember in March, we had some of the very first cases in the entire state. And so our case rate was higher than the state average back then. But that was kind of an anomaly because we just had a few people who had been traveling outside of the area. Since that time, we had kept things really in good shape until, basically right about here is where things started going up, October 13th, and then again up here, October 19th, that's where we crossed over and we were higher than the state positivity rate per 100,000. The one thing to look at here is at this point, we were significantly higher than the state. And then now the last 4 days, we have dropped down or last 5 days. And so we're below the state. We're 11.82. We're below 15 per 100,000, which is kind of a sentinel issue. So I wanted to show you that, but I also wanted to show you a couple of charts here. This first chart, again, I believe that a picture or a graph is worth 1,000 words. This is all the cases in Garrett County since the beginning of the case. And I think since the beginning, I think we're up to 177 right now. Our number, I would say, is we report a number that's higher than what the state reports, because we include those people who have tested positive with a point of care or a rapid test. And the state does not include those, but we think it's important to include those because in most cases, rapid tests are very good with determining a positive, but they're not as good with showing a negative. So sometimes when they show a negative, there should be a positive there. But with that being said, you can see right now the far and away the biggest group, two groups, is the 50-year-olds, 50 to 60-year-olds, and the 20-year-olds. And then the 10 to 19-year-olds has gone up a bit. And I would say in that 10 to 19, it really has been like the 18, 19-year-olds have been the most. I want to go to one more chart here if I can. Okay. This is the last chart I'm going to show you, but this is the weekly cases that we've had. And this is from the beginning of the pandemic. And you can see in March, we had those cases that I spoke of earlier. We had a really good run through the months of April phenomenal run through April where the state was having huge problems then. We had a great run through June where we had no cases. And then once again, what happened was this week of October, in September 28th to October 4th, our 7-day rolling or the number of cases that we had within a 7-day period began to go up. And then you see that it went up two weeks in a row, and then it began to come down. So I'm going to try to close that, and hopefully I can still be on on the call here without causing a major problem. If I lose you there, I think I'm back now. Okay, stop. I'm gonna stop sharing my screen. Okay, with that being said, now I'll just go to just some of the things to, they used to on Monday Night Football, they would have the person who gave the data and called the play-by-play, and then we had other people that would, or the color commentary. And so a bit of this is the color commentary. Our contact tracing in Garrett County, we have seen that it is mostly being spread through social gatherings and other gatherings that are sometimes, people get together for events. A huge, the biggest spreader to this point has been a couple of churches where there's been an outbreak in churches that have accounted for most of the increase in the last couple of weeks. We were above and the Autumn Glory festivals. Remember that it takes 2 to 14 days before anything occurs. And we got through all the major holidays during the summer, but my observation was that during Autumn Glory, that was more of a community event. It seemed like, and we had fewer visitors. And there were a lot of people, coming home and visiting among family members and so forth. And about 10 days after that is when we really saw a big increase. That's a correlation. That's not a cause. We can't say for certain what caused it, but that's a correlation we have. When the positivity rate goes up, and especially if it goes above 15 per 100,000, it does a couple things. One thing is that it makes it very hard for our contact tracers to keep up. And that's, when we only have a few cases, then our staff and the staff that are from the state, they're able to, my analogy is it's like playing whack-a-mole, only having 2 moles that are jumping up. It's pretty easy to play that game, but when you have 15 or 20 coming up, it is really hard. And that's where we are, and that can turn into, for lack of a better term, a death spiral if we have high rates over a long period of time, because the harder it is for us to contact trace, that means that we're not getting to people and helping them mitigate the damage that's being done. And that just becomes this spiral. And so we're really afraid of that. But we've seen that the last 5 days, things have gotten better. So we're hoping for the best on that. The other thing is that there's some automatic triggers. And I think I want all the public to understand this. If we have an outbreak in a community and we have an outbreak in a social group or different things like that, it does not just impact you as an individual. It impacts everybody, because if we go above, as we go up, then automatic triggers occur. One trigger is with nursing homes. Our nursing homes now have to test people twice a week, where prior, when we were below 5 per 100,000, they only had to test people one time a month. They also had to put in place strategies to prevent the spread in the nursing homes. And so, because we've had these outbreaks, it's really impacted these people who are in nursing homes, who, through no fault of their own, now cannot have as many visitors. They have to be tested more. It's costing more money. It's taking more resources. Also, we can have the same impact on the school system, because if we go above 15% or 15 per 100,000 for over a period of time, then then the recommendation that will go to the Board of Education is that schools be closed. That is not a good thing. That is a terrible thing for the economy, for people, for the children, for everybody. Nobody wins by that situation. And so, I really want people to get the message that we have to work as a community in order to keep these numbers down, because it really impacts a lot of people. So, what do we need to do? We need to make sure that we're taking proper precautions. There are some people who are asymptomatic, or they spread before they come down with symptoms. And so people have to be vigilant. Locally, we know that it's being spread. We can tell from our contact tracing from people who we genuinely like and care about. And so that's why it's spread it spreads through families. It spreads through, workplaces where people are friends within their workplace and they visit one another's offices. It spreads in churches when people say, well, this is my friend that I've had for years, and I don't feel comfortable wearing a mask around that person. Those are the primary places where it is spreading. We have places outside in the community we all need to wear face coverings, but I can't make it more clear that if you get COVID, you will most likely get it from somebody who you really care about and like. And so we got to do this all the time. Doesn't matter if it feels awkward. We got to keep our social distance and wear our face coverings. Politics and policy are not nearly as effective as personal responsibility. And so there are some things that we may have to take into place, and nobody will be happy with that if we have to, as a state, as a region, as a county health officer, take control and implement policies which people will say are political in order to stop the spread and protect the community. But it is much more effective if people take personal responsibilities, because you're not going to find my staff or law enforcement or anybody going into people's houses or churches or whatever saying, put a face covering on. And that's where most people are getting it. So I'm going to get off my soapbox for a little bit. And I do want to remind people of the role of enforcement. With regard to enforcement, there are things that can be done. The health department's role is to, enforce businesses. And we go out and we inspect those businesses. The role of businesses is that they need to make sure that their own employees are taken care of. And then also if they have customers encourage their customers to do the right thing. The role of law enforcement is, they're the ones that if they get a complaint from a business owner on somebody who is wearing a face covering or they're not wearing a face covering and they're insisting that they stay on the property, law enforcement's role is to come and stop that, and because the person at that point is trespassing if they're not going by the rules. And then the role of individuals is everybody take care of yourselves and encourage one another. We've had 103 complaints since July 1st. Most of those are for face masks and people not wearing face coverings. Some are for the businesses. Our staff follow up with phone calls, have gone out and made visits, and we have also issued warnings. It is a process, but it is we go out and we take an order that says if your business does not does not have a sign in place and you have staff members who are not wearing that face covering, then if we come back, then you will get an order to close. And so it's hard. We know that there are businesses that are multiple offenders, and I think people in the community knows who that is too. I'd say I would encourage people to stay away from those high risk gatherings or places where people don't feel comfortable. I did want to let you know that we have a partnership with Garrett County Schools in order to try to keep the schools open, and also with the county and emergency management, where we are offering free testing for people who are under 18 who are they have some type of symptoms, and because of that they're required to not be in school until they're tested or until they wait 14 days from the time those symptoms start. So we are offering this testing in conjunction with emergency management. And so on Mondays at Friendsville Emergency Squad, and then on Wednesdays at Grantsville from 9 to noon, there is drive up testing. You don't have to have an order for that. You don't have to have a doctor's order. You show up and say, my child has signs and symptoms of COVID. I'd like to get a test. They can test there. Tuesdays, Thursdays, and Fridays, it's available with Garrett County Health Department. We do ask that you call ahead for that one, because we have to, our people who are doing that are the ones that are also giving flu shots. And so they'll have to put on their proper, their PPE in order to do that. And so I just want to finish up by talking to you a little bit about the vaccine. I think the public needs to know that, the sooner that we get herd immunity, the sooner things will return to normal. But I know that it's a little bit scary for individuals because of how quickly those vaccines are being developed. What I want to tell you is that the Food and Drug Administration, they have a very strict protocol. They go through phase 1, which is to evaluate the vaccine on 100 people. Then if it looks effective there, then they go to thousands of people where it's tested and test the immune response on those people, on thousands of participants. Then with those thousands of participants, they're looking that it has to be at least 50% effective, and there can't be severe side effects. And they test that on adults and also people who are immunocompromised. And so they go through that process. I do know that there are still people who are concerned about it. One of the things that will happen though here first is we are in planning meetings with emergency management, the hospital, and the school system, and I'm missing law enforcement, because when that vaccine is approved and made available, the first vaccines that will come out, it's not going to be available for everybody in the county right off the bat. It will go to medical care providers, people are high risk, law enforcement, so forth. They will get that first opportunity for the vaccine. Then after that, we're putting together strategies on how to vaccine people and give it to people who are the most in need, and do that in a safe way, in order to just get it out there as soon as possible. I would say, when I mentioned that the FDA, they're looking for 50% effectiveness. Well, the 50% effectiveness for a vaccine is considered to be pretty good. For those of you who swear by supplements and different things like that, and believe me, I take some myself, but the FDA doesn't approve them, because if I'm taking saw palmetto, or I'm taking ginkgo biloba, or I'm taking something like that, it's less than 50% effective. That's why it's not approved by the FDA. And so while there could be some positive benefits with 5% of the people, or maybe up to 49% of the people, the FDA will not approve those things. It has to meet that 50% threshold. So, I encourage people to do your own research, and we're hoping that as many people as possible choose to get the vaccine. And the vaccine that is available right now is the flu vaccine. I want to encourage people for that also, because we're entering a time when the humidity when there's lower humidity, which is in the winter, and when people are indoors is when viruses spread. And so the flu is going to be spreading now, and COVID is going to be spreading more. We're seeing this across the country, and I'm sure it's going to spread here. We're going to hope that, there's a chance that things will continue to go low for us. The last 5 days, we've had, it's looked better, but there's a very strong possibility that it'll go up. And if it goes up, then we're going to have to take some steps as a community. And those aren't decisions that anybody wants to make. So I would hope that everybody can help me out, so that I won't have to make this decision in conjunction with other decision makers. So with that, I'll ask you if you have any questions.
All right, thank you very much, Bob. Very comprehensive overview. We appreciate that. And thanks for everything that you're doing. Does anybody have any questions for Bob while we got him on?
No. Good to go, Bob. Thanks.
All right, well, thank you very much, sir, and keep us posted.
Thank you, and I appreciate you wearing your face mask there and setting a very good example. Have a good meeting.
Thank you. Okay, the next item on the agenda is a resolution for the Maryland Gateway to the West Heritage Area Boundary Amendment for the McHenry Community Park. This resolution is resolution number 2020-4, endorsing an application by the Deep Creek Lions Club to the Maryland Heritage Area Authority for approval amendments to the Mountain Maryland Gateway to the West Heritage Area. Whereas the Mountain Maryland Gateway to the West Heritage Area is Maryland's heritage area, it seeks to promote heritage tourism in and around Garrett County through historic, environmental, and recreational programs and partnerships. Whereas Maryland's heritage areas are locally designated as state certified regions where public and private partners make commitments to preserving and enhancing historical, cultural, and natural resources for sustainable economic development through heritage tourism. And whereas the Deep Creek Lions Club is seeking to expand the boundary of the Maryland Gateway to the West Heritage Area based on the success of strong collaborative efforts to preserve, protect, and promote appreciation of the Meshick Browning History Center at the McHenry Community Park. Whereas the amended boundary for Mountain Maryland Gateway to the West Heritage Area will include expansion to incorporate the McHenry Community Park, a 31.73 acre tract of land listed on tax map 42 parcel 310 that is owned by the Garrett Board of County Commissioners of Garrett County, maintained by the Deep Creek Lions Club. Whereas based on the strength of the Maryland Gateway to West Heritage Area's existing heritage tourism, historic, environmental, and recreational programs, as well as the numerous public-private partnerships that have been achieved to date, the Board of County Commissioners of Garrett County deems it appropriate at this time to amend the heritage boundary. Now therefore be it resolved by the Board of County Commissioners of Garrett County, Maryland, approve submission of the Deep Creek Lions Club application to amend the Mountain Maryland Gateway West Heritage Area's boundaries. And that areas are hereby proposed as the new boundaries of the Mountain Maryland Gateway to West Heritage Area to be submitted to the Maryland Heritage Area Authority for approval. Be it further resolved that this resolution shall take effect upon the date of its adoption, adopted its second day of November 2020 by the Board of Garrett County Commissioners of Garrett County, Maryland, by its chairman, Paul C. Edwards, and attested by Kevin G. Knoll, County Administrator. Do we have a motion to adopt resolution number 2020-4?
I'll make the motion to adopt that.
All right, we have a motion. I'll make the second. If there are no questions on the motion, let's vote. All those in favor say aye.
Aye.
Opposed? Motion carries. So that will go into effect. And the next couple items on the agenda are some bid awards. Mr. Knoll, what do you have for us?
Yes, sir. We have 3 bid awards for your consideration this afternoon. The first one is bid number 20-102E. This is for the Emergency Operations Center elevator shaft construction. You may recall that the last meeting you awarded a bid for the elevator itself. This is for this construction of the shaft. There was 1 bid received from Daystar Builders in the amount of $95,200. This bid, as well as the next bid we want to discuss, both of those are eligible for state bond funding, funding that we received from the state for this project in conjunction with general funds that were allocated in prior budgets for this construction. So there's no new general fund funding being used for these projects.
All right. Let's do the next one as well.
Okay.
We'll do those together.
So the next one is bid number 20-1022H. This is for HVAC upgrades for the Emergency Operations Center. There was 3 bids received. Rush Services in the amount of $28,372. Daystar Builders in the amount of $41,496.64. And Beitzel Corporation in the amount of $45,710.73. The purchasing department is recommending the award of the bid to Rush Services in the amount of $28,372.
All right. So we'll take those 2 as a slate. Any questions for Mr. Knoll on the EOC HVAC upgrade and elevator shaft construction?
On the second one, we had approved money for that already. Is that correct?
Yes, sir. Yes.
I'll make the motion to accept both of them.
All right, we have a motion. I'll second that. Question on the motion. All those in favor say aye. Aye. Opposed? Motion carries. Before we move on to the next one, now that has been allocated, so this project, the EOC at the McHenry, in McHenry, something we've been talking about now, I think, for 6 years. We've got a lot of state money for that. I know we've been budgeting throughout the years to make that happen. Are we trending right now, Mr. Knoll, all these projects like this that we're looking at? Are we right on budget overall? Are we trending to the positive? Is there anything that looks like an alarm that things might escalate from price, or what's the feeling there?
Actually, we're trending under budget.
That's what I thought.
And in addition, there are some additional state grant monies that we'll be able to use for as the backup 911 center that was not included in the original budget when we budgeted the money several years ago. So we should save some additional money on top of that.
So that's great, and that's what I thought. I just wanted to make sure. Any idea when that project will be completed? The EOC project completely?
We're probably looking at spring, realistically.
Okay. All right, next bid.
Our next bid is bid number 20-1022 WA, winter abrasives and road salt. There was 12 bids received. George's Creek Stone and Gravel, Keystone Lime, Maryland Minerals, Fairfax Concrete Products, Allegheny Aggregate, Belmont Aggregate, Stone Asphalt LLC, Cargill, Eastern Salt Company, Government Millo Supplies, Boydco Holdings, and Mid-Atlantic Salt. Now, these bids were for both road abrasives, anti-skid, as well as road salt. We do use a little bit of road salt, not a lot of it. So depending on the location of the quarry and the delivery cost or the pickup cost, the roads department is recommending that the following quarries receive the bids. And this is George's Creek Stone and Gravel, Keystone Lime Company, both in Elkhorn and Cranesville, Maryland Minerals, Fairfax Concrete Products, Allegheny Aggregate, Belmont Aggregates, Stone Asphalt, Mid-Atlantic Salt, and Cargill Salt. Now, the roads division will determine the quarry to purchase the winter abrasives and road salts based on the garage location, the hauling cost, and the availability of the item from a particular quarry.
All right, questions about that?
One thing I will note is that stone prices overall represent approximately 2% increase over 2019's cost. The anti-skid prices increased approximately 2.5%, and road salt actually decreased about almost 10%.
All right, any questions?
No, sir.
Hearing none, do we have a motion to accept the purchasing department's recommendation?
Make the motion to accept that.
I have a motion, I'll make a second. Question on the motion. All those in favor say aye.
Aye.
Aye, opposed? Motion carries. Thank you very much. Anybody have anything else to order of business? If not, just a couple of announcements. I do want to remind everybody out there to vote if you haven't already, tomorrow or tonight before 8 o'clock. Remember that there's only 3 polling places open tomorrow, and that is the old Armory here in Oakland, Northern High School, and the Garrett College Outreach Center in Grantsville on Hilltop. This seems to be a banner year in voting, probably nationwide, but also here in the county. Mr. Knoll spoke with Board of Elections today. By the close of business today, the anticipation is to be over 65% turnout, which is fantastic before we even hit election day, with about 13,000 early and mail-in votes having been cast by then. So certainly do civic duty tomorrow and get out to one of those 3 polling places if you haven't already, and vote. Otherwise, our next meeting is November the 17th. So we'll be back here on Zoom. And if there are no other announcements or questions, I'll entertain a motion to adjourn.
And I'll make a motion to adjourn.
This meeting is adjourned. Thank you very much.